Here with the answers to the latest questions we've all been asking is our resident medical expert, Dr. Lukasz. All right, Dr. Lukasz, let's begin with the question I've heard over and over again this weekend, and it is, how does coronavirus compare to influenza? Because every year, thousands of people die from influenza. Is coronavirus that much more aggressive?
Well, good morning, Carolyn, and that's a great question. And people like yourself have maybe seen the graphic that compares the flu with the coronavirus. And here are some facts that we know. The flu infects an estimated billion people worldwide and is in the tens of millions in North Americans each year. Compare that with the coronavirus, which is now over 100,000 people. And when we look at the number of deaths, there's estimates that this season alone, there's been over 600,000 people that have died worldwide from the flu, and we are approaching 4,000 from this coronavirus. But the major concern remains that the coronavirus is evolving. It's changing rapidly. It's a new virus. Our bodies have never seen it. We don't have immunity to it. So we don't fully know what it's capable of. That's why I think everyone is on full-blown alert mode, but we should never lose sight of how bad the flu is every year as well.
All right, so if I get the coronavirus, here's another question people keep asking. What are my chances that I'll fully recover?
So what we know so far is that 80% of people will have a mild asymptomatic course. 15% of people will have a severe infection requiring oxygen, and 5% of people will have a critical infection requiring ICU and a ventilator. So I crunched the numbers late last night also, and based off the cases that have been reported, if infected with the virus, the death rate right now is 3.5%. What's clear is we probably don't have the right denominator, which means there are cases that are asymptomatic or have been very mild, and these patients haven't been tested. Let's put this into context when we talk about the flu. The death rate from the flu is 0.1%. So that's a stark contrast to 3.5%. That's 35 times higher. But I will repeat, we don't know all the cases. I suspect the percentage will go down. And with more testing, we're still learning, and the situation remains very, very fluid, Carolyn.
As you said, this virus is mutating, so that is troublesome as well. Okay, the federal government is sending a plane to bring a couple hundred Canadians home from a cruise ship docked in California. Should we avoid traveling right now?
That's a loaded question. I think, in short, you should always follow the CDC travel advisory website, which is updated regularly, and it's the best place to look. I myself have been traveling in North America within the last few weeks, and I've even had someone sit next to me on a plane with a surgical mask who was coughing, and I still felt comfortable flying. But myself, I would not go on a cruise at this very moment. Very importantly, just yesterday, the CDC went on record and announced emphatically, if you're a person with an underlying condition, particularly an elderly person with an underlying condition, you should distance yourself from the risk. And that includes large crowds, getting on a plane, and above all, not to be on a cruise ship.
Okay, if I'm exhibiting flu-like symptoms, can I ask to be tested for COVID?
Yes, if you're sick, absolutely you can be tested. And all physicians in Canada have been receiving these emails from provincial authorities detailing what to do in case there's a concern that a patient is infected. There are public health offices in all local municipalities and regions that have been designated for patients to come and be tested accordingly. The key feature here that I want everyone to remember is that if you have those common symptoms, the cough, the fever, the shortness of breath, and you've been in contact with someone who's been in an endemic area where there's explosion of cases, call your family doctor or call the emergency department first before showing up. We don't want people to just expose others unknowingly, and we want to prevent this transmission full stop. So be alert, call in advance, don't just show up.
So even if I don't have a connection to someone who has been in direct contact, I can still ask for such a test?
I think this is a discussion to have with your healthcare practitioner. Yes, it is spreading in the community, so potentially you didn't even know you had contact with someone from one of these areas. But I would discuss this with my family doctor or the emergency doctor in advance. We don't want just anyone going to the emergency room with a scratchy throat saying, test me for COVID-19 or this coronavirus. So it's a conversation to have with the doctor before the testing fully gets sent out.
Okay, as you know, hand sanitizer and masks are hard to find these days. How effective really are they in keeping you safe?
So, Carolyn, maybe you've been seeing this, but all across North America, everyone is buying out not only toilet paper, but also all the hand sanitizer. You can't even get it on Amazon unless you're willing to pay hundreds of dollars. So, in short, yes, hand sanitizer is effective if, and here's the key, there's at least 60% alcohol content in the hand sanitizer. So buying any old hand sanitizer, especially if it's alcohol-free, is not going to get the job done. Furthermore, soap and water remain your best friend. I can't tell you honestly how encouraging it's been these last few weeks in airports, restaurants, bars. I see all men washing their hands for the full 20 seconds. I'm sure this is probably happening in the female bathroom, Carolyn, but it's been a revelation and a big positive, at least from the awareness that has been spread about the transmission.
Okay, finally, if I'm a snowbird, should I come home?
It's a great question, and at the moment, I think I'll echo what I said earlier. If you have comorbidities, if you have a medical condition, do not travel at this moment. Stay put. But this is evolving. We'll see what happens on a day-to-day. The risk is real, and everyone needs to be tuned in regularly for updates, and we'll see how this progresses. But for right now, if you have an illness or if you have a medical condition, I would not come home. I would stay put in Florida at the moment.
All right, Dr. Lukasz, great information as always. Thank you so much.